Emma Mijas died a horrible and painful death unnecessarily on her very first Christmas Eve 2004 at the hands of 25 doctors and nurses, another victim of medical malpractice. All 25 doctors and nurses systematically administered the wrong drugs for her life-threatening condition called SLOS. SLOS, Smith-Lemli-Optis syndrome, is a congenital abnormality which requires treatment strategies on supplying supplemental cholesterol. They gave Emma the wrong drug, Questran, not once, but 92 times. Yes, 92 times in 1 month. A cholesterol-reducing drug, not the cholesterol supplemental drug she needed. All of them knew better. They were trained to know better. They were some of the world's leading authorities at the Louisiana State University Health Science Center in New Orleans. But they just didn't give a damn about Emma's life. In 2013, the prestigious Journal of Patient Safety published a study that as many as 440,000 patients die each year from preventable medical errors. That would make medical errors the third leading cause of death in America, behind heart disease and cancer, which is second. These people are not dying from the illnesses that caused them to seek hospital care in the first place. No, they are dying from mistakes that hospitals could have prevented. What are these fatal errors? Who are these incompetent and negligent doctors? A New England Journal of Medicine, January 28, 2016 study reported that 1% of physicians accounted for 32% of paid malpractice claims over the last 10 years. The ugly truth is that little is being done to hold these dangerous doctors accountable. Researchers found that bad doctors showed distinctive characteristics, including having paid previous malpractice claims. So it stands to reason that healthcare providers could eliminate 1/3 of medical malpractice along with patients' pain and suffering, as well as the added cost of corrective surgeries, long-term care, and indemnity payments by removing the worst 1% of doctors. Why aren't bad doctors stopped from practicing? The answer lies, at least partially, in the National Practitioner Data Bank, a clearinghouse for information on medical malpractice that Congress established in 1986 to help state licensing boards police the healthcare industry. The national database was supposed to help states identify dangerous doctors and prevent them from harming more patients, and is used by hospitals, insurers, and licensing boards to track doctors' records, check prospective hires, and make other decisions. But it is virtually useless in holding doctors accountable because, by federal law, none are listed by name. They are assigned a random number to protect their identities. Even if doctors were identified in the data as they should be, the public would still be barred by law from accessing the records. So vulnerable, sick patients sit in the waiting rooms of bad physicians without a clue about their poor record of performance. And in many cases, a negligent doctor's insurance company pays the victim of malpractice and the doctor goes back to work. If a doctor develops a bad enough reputation in one town, he can move to a new state and continue practicing. This is unbelievable. But today, the public does not have access to the database to identify doctors' names and addresses, to identify doctors with uniquely long histories of being sued or disciplined for medical malpractice. Because on September 1st, 2011, the government cut off public access. What was behind that decision? Apparently, one Kansas doctor with a trail of malpractice suits, Dr. Robert Tenny. The Kansas-based doctor complained to the Government Health Resources and Service Administration that the Kansas City Star newspaper was publishing the story of one of his patients, Maribeth Chase, who died in 2007 after undergoing a brain surgery with Dr. Tenny. It is also noted that Tenny had been sued at least 16 times for medical malpractice, but had never been disciplined by the state's licensing boards. The Insider Exclusive produced a TV story on this case with the lawyers who represented Marybeth's family when doctors go bad, Maribeth Chase versus Dr. Robert T. Tenny. Tenny finally settled the Chase family's wrongful death suit for $1 million. The settlement brought total malpractice payments paid on Tenny's behalf since the early 1990s to roughly $3.7 million. In some states, including California, Colorado, Georgia, and New York, patients can go to medical boards' websites to find out about doctors' malpractice histories, but not in Kansas and Missouri. In this Insider Exclusive network TV special, Justice in America, Connie Lockhart's story, we visit with Connie's lawyer, Lloyd Bell, founder of Bell Law Firm, as we take you inside today's legal system, examining his legal strategies, and in vivid detail showing you the often heartbreaking stories of medical malpractice cases like Connie's. Here's Lloyd Bell, Connie's lawyer, to give you an insider's devastating critique of modern medical practices and an honest view of what our broken healthcare system looks like.
The reality of patient care today is there is room for significant concern. There was a study that came out recently from Johns Hopkins University, which found that of all the causes of death in America each year, medical malpractice accounts for the third leading cause of death. Medical malpractice. That's the equivalent of 2 jumbo jets loaded with passengers crashing every single day of the year. That is unacceptable in a modern country, a successful country such as the United States. So the reality is that there's a real problem out there. So roughly 1% of doctors cause about a third of all medical malpractice cases in America. 1%. So why aren't they being pushed out of medicine? Why aren't they being drummed out of the profession? And the answer to that is, I believe, part of it is politics. These are professionals who have their licenses, and they fight very hard to keep their licenses. And another reason that these doctors are allowed to continue practicing is they can move around. They can move from state to state. So if they get held accountable for medical malpractice in Georgia, they can move to other states in the country that have different laws that may be willing to allow them to practice. So it's a real problem. And the biggest problem is that patients don't know this. They don't know who those doctors are. You know, doctors are humans, just like all of us. And like human beings, we all make mistakes, including doctors. But there's something about a medical mistake, a professional mistake, that so many doctors are reluctant just to say they're sorry, just to look the family in the eye and say, I am very sorry, I made a mistake. It's hard for anybody to do that, but I have seen that it's extremely hard for a doctor to do that. And it's unfortunate. There have been studies that have come out that prove and demonstrate that if doctors will just accept responsibility and admit their mistakes, that families and victims of malpractice are far less likely to sue. As more and more hospital groups are acquiring smaller doctors and more doctors are practicing together, it seems like communication between the professionals is decreasing. People will communicate, doctors will communicate through electronic medical records, but they don't talk to each other like they used to. They don't pick up the phone and say, Dr. Jones, I see you sent this patient to me for this reason. What's going on with this patient? Talk to me. They don't have the face-to-face communications like they used to. They essentially hide in the computer. They hide in the medical record. And they say, well, if I put it into the medical record, the people that need to see it will see it. So the lack of communication is a real problem among the professionals. Another big change that needs to happen is a movement away from this assembly line factory mentality of caring for patients. Some doctors, primary care doctors, will see 60, 70 patients in a day. You can't see that many patients in a day. You can't even barely get to know somebody's name with that many patients in a day. The old days where a doctor would actually sit down with a patient, look them in the eye, tell me what's going on, spend time with them, get to know them over a period of time. It just doesn't happen as much as it needs to. So that's another change. There needs to be greater communication. There needs to be more time spent between the doctor and the patient. One last thing I would offer as well is there needs to be less reliance on other specialties to do your job. If you're the doctor and you're caring for a patient, that is your patient. And it's good to involve other specialties. That's helpful, that's needed sometimes, but that's still your patient. And too often, patients will be sent from Dr. A to Dr. B to Dr. C, and each of those doctors along the way will look at that patient through their specialized lens and not look at the whole patient. So it kind of ties into a lack of communication, but it also is a siloed kind of thinking where every specialist looks at the patient through their specialty lens and doesn't look at the whole patient. And patients fall through the cracks that way and they don't get the care that they need.
This is the Insider Exclusive, live from Atlanta, Georgia. It is my great pleasure to introduce Lloyd Bell to the show. Welcome to the show, Lloyd.
Thank you. It's great to be here.
Tell our audience a little bit about your practice of law. It seems like you do a lot of medical malpractice cases. Why?
I do a lot of medical malpractice cases. I've been practicing now for about 20 years, and I come by it rightfully. My father was a doctor. He was also a lawyer, and he sort of opened me up to the need for medical malpractice lawyers who are willing to take on these cases. These cases are extremely challenging, they're expensive, and they require a specialized interest in medicine. And on a more personal level, my brother was a victim of medical malpractice. He was a service member, and he served in Iraq, he served in Afghanistan, and was exposed to the chemicals in the atmosphere, and he developed lung cancer. And he came back to the States, and it was not diagnosed by the Veterans Administration for many, many months. They didn't give him the appropriate tests. And at the age of 53, he died of lung cancer. Medical malpractice is very personal to me, and I'm very committed to the victims of malpractice and trying to help them obtain justice.
You are also representing Connie Lockhart. Tell our audience a little bit about Connie.
Connie Lockhart is a lovely lady who lives in a community just north of Atlanta. And Ms. Lockhart came to me after she had her right lower leg amputated because of medical malpractice. And what happened to her is Connie had been taken to the emergency department by the EMTs. She had extremely low blood pressure, and the emergency room physician decided that she needed what's known as a catheter, which is just a plastic tube that goes into one of the major blood vessels so medicine can get into her body. Well, the ER doctor put in the catheter. He tried to put it into the vein in her neck, and he was unsuccessful. So then he tried to put it into the vein in her groin, which is known as the femoral vein. And veins move blood towards the heart, arteries move blood away from the heart. Well, you're supposed to stick this in the vein so that the medicine is taken up by the heart and sent out around the body in a sort of a uniform way. If you think of a sprinkler on your yard, it's kind of like the sprinkler that spreads the water evenly across the yard. Well, the doctor missed. He didn't use the tools that were available to him to make sure he put it in the right place. And instead of sticking it in the femoral vein where it belonged, he put it in the femoral artery. Well, that's a real problem, because when he put it in the artery, when medicine started going through that catheter, medicine designed to save Connie's life and to raise her blood pressure, instead of going up to her heart and being spread around her body, it all concentrated and went down into her lower leg. And it clogged up the blood vessels, and it caused her leg to become necrotic, turn black, and die.
And how long a period of time did this take place?
Over about a 24-hour period.
All within 24 hours?
And all this medicine has been going down into her leg. And her leg was normal, or appeared normal according to the nurses, when they would check on her over the evening. But the problem is that when the nurse first noticed that Connie's leg had become cold and mottled and pulseless, the nurse called the doctor who was on duty, Dr. Lavania, who was the defendant in the case, and reported this very concerning emergency situation to the doctor. and he didn't come in to see her for many hours.
Why not? It was an urgent situation.
It was an urgent situation. He offered no good explanation.
What is the policy in a hospital if you can't get a hold of, because sometimes you can't get a hold of a doctor? Isn't there should be a on-duty specialist to be able to take care of this?
Well, certainly, doctors are on duty. They have certain designated doctors who are supposed to respond to incidents like this. And Dr. Lavagna was the on-call physician. Now, if he could not come in for some reason, say his car broke down or he had some injury himself, whatever it might be, it's his responsibility to call his partner and have his partner come in. But what can't happen is Connie laying in a hospital bed as her leg slowly dies because she's not getting the care she needs. And that's what happened. And nobody figured out that this catheter was in the wrong place for many hours later, until finally a very experienced nurse, very knowledgeable nurse, figured it out, called Lavagna and said, "Oh, by the way, the catheter is in the wrong place." And Dr. Lavagna over the telephone said, "Well, stop the medicine from going into it." But he never came in for hours, even after that, to try to reverse the problem that was killing Connie's leg.
Is there a way when doctors, let's say, put it in an artery rather than a vein, is there a way for them to see what they've done wrong immediately?
Absolutely. There are a number of ways to do it. One way is to use a machine called an ultrasound. It's just like what pregnant women will see their babies and the fathers will see the baby on the screen. Same idea. And the ultrasound was available, but for whatever reason, the ER doctor decided not to use it. So the ER doctor is the one who placed it in the wrong place, but it was the on-call doctor hours later who didn't come in to care for Connie when he should have. But the ultrasound is one way to check. Another way to check is to take a sample of the blood and to send it to the lab where they can quickly tell you if it's artery blood or venous blood or vein blood. And the third way to do it is they put a little device up on the line, a little box, looks like an iPhone, and that can also tell you if it's vein blood or artery blood.
I understand you went to trial in this case.
We did.
What happened?
We won. We got a verdict against one of the defendants in the case, a Dr. Lavagna, and the jury returned a verdict of over $4 million, finding that he had committed medical malpractice and that his medical malpractice had caused Connie to suffer damages. And the jury returned that verdict in our favor. The other doctor who was in the case was released by the court on what's called a directed verdict. And a few days before closing argument, the defense made a motion that the emergency room doctor should not be in the case anymore. And the court agreed with that position. Of course, we disagree with that position. And we've asked the court to reconsider. And eventually, the case may have to go up to the Court of Appeals to have them look at the issue.
So the verdict that you got stands?
It does stand. The case is resolved against Dr. Lavagna.
And you're appealing based on the fact that is it Dr. Bloom?
Dr. Bloom is the ER.
Should not have been released from the case, right?
Well, at this point, we're asking the court to give us a new trial against Dr. Bloom. And if that's not successful, then most likely the case will be appealed.
Okay. When are you supposed to go to court for that?
Hasn't been scheduled yet. We anticipate that by the end of the year.
What are some of the hurdles that you have in where you are right now with this case?
Well, it's always a hurdle to get a new trial. I mean, there are challenges to do that. But if we get a new trial, then the next hurdle would be to get on a trial calendar, and then there'll be another trial just against the ER doctor. And if that's not successful to get a new trial, then the Court of Appeals is the likely next stop.
Well, good luck with that, and we'll be rooting for you.
I appreciate that. Thank you.
Since you are well known for getting successful verdicts and settlements in medical malpractice cases, a lot of people will contact you. How do you determine the cases that you want to handle?
Well, unfortunately, we can't handle every case that comes to us. We have to focus on the types of cases that we are best equipped to handle. So the first question we look at is, what has been the outcome of the supposed malpractice? Unfortunately, it has to be a catastrophic injury or a wrongful death. So that's the starting place. What's been the outcome? We see a lot of cases of medical malpractice where the potential client will approach us and explain a horrible situation they've been through, but if they've had a full recovery, that's not a case, unfortunately, we can take on. So we look at the injury, and then we get the medical records, and then we examine the medical records. We have a medical staff that's available to us to review the records, and we kind of put on our Sherlock Holmes hats and start investigating and start digging, and then we go through that process. We tell our client every step of the way what we're discovering, and then ultimately we have to make a decision. Is there malpractice? If yes, is it a case that we can proceed? And if it's not, we have a wide network of attorneys we refer cases to. But if it's a case that we take on, then obviously we'll bring all our resources into that case.
Good. Well, good luck with this case, and thank you for being on the show.
Thank you for having me. It's been a pleasure.
Thanks for joining us. You can get more information about our guest and the issues at insiderexclusive.com.